In our video, How Doctors Are Paid, we mainly considered how doctors are compensated when they are employed by hospitals and health systems. Today, we review how doctors are paid in private practice settings. That is, if a doctor owns their own medical practice. Remember, depending on who a doctor works for, doctors are paid a little differently. For instance, if a doctor is an employee of a hospital, he generally gets paid regardless of how much money he generates for the business. Of course, this model can't last forever. However, in a private practice owned by the doctor only gets paid when there is money left over and after all of the expenses are paid. Basically, it's a small business management. Since we discussed hospital-employed doctors, let's now ponder doctors who are in private practice. That is, they own the business or medical clinic. As a caveat, as with all of our videos, remember that one size does not fit all, but that the fundamentals explained in this video do happen throughout the United States. In this case, pay rates and amounts can vary by group size. Example, a few doctors or a lot of doctors, private practice, location, and other factors. In private practice, doctors generate and collect revenues by seeing patients. So a patient might have an office visit or a lab test or a diagnostic study. The doctor bills them or the insurance company, then the practice or the business collects the money for the services rendered. After the clinic bills are paid, the leftover money can get paid out to the owners as compensation. For instance, let's say Clinic X collects $100,000 in June. The bills for June, including employee salaries and pay for any doctors who are employed by the practice but aren't owners, rent, equipment, IT, etc., are $50,000. That means there are $50,000 left over to pay the shareholder, the owners, or shareholders. The owner or owners may decide to pay out the leftover $50,000 or pay themselves a fixed salary of, say, $20,000, then maybe reinvest the remainder, $30,000, into the business. Either way, a lean month where expenses are more than collected revenues may mean that the owners do not get paid. Too many lean months with that math, and the practice, like any other business, may go out of business. As we discussed in our video, How Doctors Get Paid, the key difference between doctor compensation in a private practice and hospital-employed doctors is that in the hospital, doctors receive their pay regardless of whether the hospital collects money. The hospital has a contract with the employed doctor to pay them a salary, whether it's based on production or fixed pay. Example, a standard salary like you might receive at your job. The variable might be the number of relative value units produced, or RVUs. In the private practice, you must generate revenue and efficiently collect money due to the practice to compensate the physician owners. At Cubed, our goal is to educate consumers and offer a broad picture of what some of these compensation arrangements may look like. Remember, these videos are not meant to answer all questions precisely. There are simply too many compensation plans throughout the country, but this and our other videos are directionally accurate across the United States. Just remember, some nuance exists geographically. Healthcare really is local. To understand more about doctor pay or offer a topic you'd like us to explain, please subscribe, like, or share. And if you have any questions, email them confidentially to questions@cubed.org. Stay tuned for the next educational video.